Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be answering questions from the comment section in our videos. So if you find this information helpful, give the video a like, make sure to subscribe if you haven't yet, and tap the notification bell. Let's go ahead and get started. Alright, first question is from Vonnie. I have a simple deep bite, but my lower jaw is quite smaller than my upper jaw, and my lower jaw incisors got crooked because I started mowing recently. So can they be treated easily just by braces? I'm 19 years old right now. And do we have to wear retainers for our whole lives? Okay, so we got a couple questions here. We'll go through them. So I have a simple deep bite, but my lower jaw is quite smaller than my upper jaw. So that could mean that the upper jaw is too wide, or it could be that your lower jaw is set too far back. So both conditions can be treated. Just depends on which one is which. I started mowing recently, so this is something we can speak to. It is a trend that, is one of those things that pops up on social media where people get the idea that they can fix their own teeth and their own bites and doing different things by pushing their tongue to the roof of their mouth. And that somehow will expand or correct or fix their, tooth or bite problems just simply by applying pressure to the roof of your mouth. So generally speaking, putting pressure against the roof of your mouth can move teeth, it can change different things, but every tooth and bite problem is so different that you may not be doing anything positive for your situation. So I definitely wouldn't recommend doing this procedure yourself. It's not recommended. It's similar to sucking your thumb and pushing your thumb to the roof of your mouth. Yes, that does move teeth, but generally it is not a positive movement. It's not moving your teeth in the right direction. It's not doing good things for your bite. And so mowing, it's not something orthodontists recommend simply because it is unpredictable. Some people have reported positive results. I think most people do not actually do it long enough or enough to even get a result. And some people, if you do it and that's not the result you wanted, to expand the upper arch and to widen things out, it's not going to be a positive thing. So again, in your case, you said your upper jaw is bigger than your lower jaw. I have no idea if that's due to the mowing treatment you're trying to do at home, but I would definitely recommend a consultation with an orthodontist. If your problem is just a deep bite and crowded lower incisors, that's something very simple to fix with braces. And so at 19, you can still get a lot of things fixed. I would definitely recommend seeing an orthodontist for this. I kind of relate it to, you could try to cut your own hair, but you may not like the results. So again, if you're trying to fix your teeth by pushing your tongue to the roof of your mouth, you might do something, but you may not like what you see. So hopefully that helps. And last question, do we have to wear retainers for our whole lives? I tell my patients only wear them as long as you want your teeth straight. So if you want straight teeth for life, the only way to guarantee that is retainers for life. And generally speaking, that's wearing them a couple nights a week for the rest of your life, or as long as you want your teeth straight. Our bodies are always constantly moving and changing. Just like if you stop going to the gym, that six-pack that you got from going to the gym for so long is not going to stay there. You have to keep going to the gym and keep doing those exercises in order to maintain that physique. Same thing with your teeth. If you get your teeth straight, the only way that they're going to stay there is through retention, unfortunately, for life. All right, next question. This is from Chris Davis. Can Invisalign correct a mild overbite in an adult? Yes, that is definitely something that can work. We have a video about how Invisalign fixes overbites. We'll link to the video right above. So that is definitely something that Invisalign can do. So check out that video and hopefully that helps. All right, next question. This one's from Tea Time. Hi, I got braces when I was in grade 7, and they were not experienced. I wore braces for 5 years, and my teeth still don't look perfect. They extracted teeth from the top during the procedure, causing me to originally have an overbite, then go to an underbite. Fast forward, I got my braces off last year, but my bite is still off, and my smile midline is horrible. I went to an orthodontist, and he originally recommended Invisalign, but I thought it wouldn't fix my problems, so I want to wear braces again. I'm still thinking which one I should do, which one would be more efficient. So as far as your first question, it sounds like you're asking mostly I would recommend braces or Invisalign. And that really depends on the tooth or bite problem we're trying to fix. So if it is just a mild problem with just mild amount of crowding or spacing or whatever, Invisalign is usually quicker for those type of things because we can be very specific. So you had braces for quite a while. I'm assuming your teeth are in not a bad position. So if you're wanting to do just mild correction, Invisalign might work great. If you're trying to get some major movement, major things, shifting around, usually braces will work better for those type of treatments. A lot of times they'll work equally well also. If the treatment is somewhere in between, you can choose braces or Invisalign, and it just depends on what fits your lifestyle best. So again, ask your orthodontist. Most orthodontists can get you a great result using braces or Invisalign, but there are some cases where one treatment option may be better than the other, but is very specific to the type of tooth and bite problem you have. So hopefully that helps. All right, this question is from Casey K. Does your wisdom teeth or tooth have to be pulled out prior to getting braces for an open bite? So generally speaking, if your wisdom teeth haven't erupted yet, meaning that they're still under the gums, they don't really impact your tooth or bite currently, and they don't need to be taken out for orthodontics. So if those teeth are getting close to coming in, or if they're starting to cause pain or discomfort, or if they're already in and they're causing some sort of tooth or bite problem, that's when they may need to get taken out. But generally speaking, if you're young, your teeth haven't erupted yet, they don't really impact what we're doing. So for example, if we're trying to push all the teeth back on the upper arch, that's where we might need to get those top wisdom teeth out. If we're trying to push all the teeth back on the lower arch, again, those wisdom teeth will get in the way. So those are cases that you may need to have them out. For an open bite, generally they won't really impact much unless they've already erupted and you're biting on those teeth. In that case, it may be helpful to have those out. So again, that's very specific. I know that's a lot of information, but definitely ask your orthodontist. They'll be able to guide you specifically on your case, whether with your wisdom teeth need to be taken out before, after, or during treatment, or not at all. So can aligners fix a unilateral posterior crossbite in adult? So crossbites are sometimes difficult to fix with aligners. So if it's a single tooth crossbite, meaning that just like one molar or one bicuspid is in a crossbite, that's usually something that can be fixed with just Invisalign. You might need to use some rubber bands as well. For a full crossbite, meaning that the whole segment of the arch or all the teeth from the bicuspids all the way back to the molars are in a crossbite, that may be more difficult to get completely fixed with Invisalign. So especially in adults, crossbites can be difficult to fix. Sometimes if it is more of just like a tooth crossbite, we could use something like a quad helix expander. Prior to doing Invisalign, we can get expansion from that expander and then help get that crossbite fixed and then transition to Invisalign. If it's more of a skeletal crossbite, meaning that the whole upper arch or the whole upper jaw is too narrow, full correction of that type of crossbite may require some sort of jaw surgery. It really depends in this case. I would definitely recommend getting a consultation with an orthodontist. So if it's really mild, just a single tooth, that probably can be fixed with Invisalign. If it's kind of like a mild whole arch one, that might be able to be fixed with an expander. If it's really severe and more of a skeletal crossbite, then we're looking more into surgery. Again, crossbites in adults get a little bit more complicated. In teenagers or preteens, it's much simpler. So hopefully that helps. So that is our video for today. So if you found it helpful, give the video a like, subscribe if you haven't yet, and tap the notification bell. If you have any questions, ask them in the comments section below, and we may answer them in a future video. Thank you so much for watching, and we'll talk to you soon.